Hello everyone, I am Dr. Manas Kumar Das, Director, Orlean College of Pharmacy. Today I will teach you pathophysiology, the code is BP204T, lecture number 6. Today's topic is mechanism of inflammation. In last slides, we have already studied about the what is pathophysiology, different definitions of pathophysiology, related to the pathophysiology, what are the different streams subjects like biochemistry, like microbiology, all are related to the pathophysiology that we studied. We studied about the homeostasis, we studied about the feedback mechanism, positive and negative feedback mechanism. We have also studied the cell injury, reversible as well as irreversible. Then in the last slide we studied about the inflammation, what is inflammation, types of inflammation and signs and reactions of inflammation. Now, in today's topic we will discuss about the mechanism of inflammation. Here I will discuss the PPT on the basis of these contents. So, first we will study about the what is inflammation and some discussion, some introduction about the inflammation. Then acute inflammatory response, vascular events, hemodynamic changes, altered vascular permeability, cellular events, cellular changes and exudation of leukocytes. So, today I will cover all these points in this present PPT. So, first come with the introduction. Inflammation is the immune system's response to harmful stimuli, that is pathogens, damaged cells, toxic compounds or irradiation, and acts by removing injurious stimuli and initiating the healing process. So, this is inflammation. So, what is inflammation? Again, inflammation is the immune system's response to harmful stimuli, that is pathogens, damaged cells, toxic compounds or irradiation, and acts by removing injurious stimuli and initiating the healing process. So, in the inflammation we know already this is a kind of our body's defense mechanism. So, the healing process will start. So, inflammation is a defense mechanism that is vital to health. During acute inflammatory response, cellular and molecular events, these are the two big points of our inflammation, cellular and molecular events, and interactions efficiently minimize impending injuries or infection. This process contributes to restoration of tissue homeostasis and resolution of the acute inflammation. So, what actually it happens? Inflammation is a defense mechanism which you will already know, that is our body's defense mechanism. It is having a vital role in our health system, in our health of the body during acute inflammatory response. So, what will happen? Cellular and molecular events will start and interactions efficiently minimize the injury or the infection. So, by this way our body will restore the tissue homeostasis to the initial stage. It will try to restore the tissue homeostasis as the earlier it was. Next come to the acute inflammatory response. What I told, there are two stages, vascular and cellular. The two major components of inflammations are vascular stages and cellular stages. So, this is vascular and this is cellular. These are the two stages. So, what is vascular stage? Leads to an increased in blood flow. By this way, by the vascular stage, the inflamed area will leads to an increase in the blood flow will increase, and changes in the small blood vessels of the microcirculation. microcirculations means arterioles, venules, capillaries. The small blood vessels are altogether called as microcirculations. So, changes in the small blood vessels of the microcirculation, and in cellular stage leads to migration of leukocytes from the circulation. So, in the cell level what will happen? It leads to the migration of leukocytes from the circulation. Their activation to eliminate the injurious agent. Their activation to eliminate the injurious agent. So, the leukocytes which are migrating, WBC is our defense factors. So, leukocytes will come from the blood vessels and it will come outside the blood vessel in the interstitial space, and they will be activated, and they will be activated to eliminate the injurious agents which are actually antigens which has come from outside our body or inside our body also some damaged cells from necrosed cells, these are also injurious agents. So, the cells blood cells will act against all these injurious agents. So, these are vascular stage and cellular stage. Now, come to the vascular event, that is a beautifully it has been shown. First one is normal circulation, second one is the inflamed circulation. Inflamed means when there is inflammation. Vascular events, alteration in the microvasculature of which one? At arterioles, capillaries and venules. So, small arteries are arterioles, capillaries and small veins which are called venules are altogether called microvasculatures. So, alteration in the microvasculature is the earliest response to tissue injury. So, this is the response which we can see as earliest in the during the time of tissue injury. So, in the normal vasculature what you can see? Extracellular matrix that is intact, extracellular matrix is there properly, arterioles are also working properly. Now, occasional resident of lymphocytes or macrophages, occasionally you can see, not very much, and this is venule, this is arteriole, blood is coming, this is the capillary and this is venule, it is going out. Now, come to the inflamed one. So, see first one, increased blood flow. Why? Because there is arteriole dilation, there will be dilation of the arteriole. So, when there will be dilation, see because of this blood flow will increase. So, expansion of capillary bed, expansion of the capillary bed will be increased. So, increased blood flow will increase the expansion of the capillary bed, and also venule dilation, veins also dilated, arterioles also dilated, veins also dilated, and neutrophil immigration. Neutrophil immigration will happen. Here you cannot see neutrophil immigration. So, here it is very much prominent, leukocytes have as neutrophils has come out from the blood vessels, and leakage of plasma proteins, it is plasma and the proteins is leaking from inside the blood vessels to the extracellular space, and it is causing edema. Okay. This is causing edema. So, these alterations include hemodynamic change and altered vascular permeability. These are the things you can see in these two diagrams. One is normal and another one is the inflamed one. Next, come to the hemodynamic change. The earliest features of inflammatory response results from changes in the vascular flow and caliber of small blood vessels in the injured tissue. The sequence of changes are as follows. So, in the hemodynamic change, in the inflammatory response, there are sequences. So, here I will tell you the sequences of the changes. First one, transient vasoconstriction. So, in the last presentation, I have told you briefly about the just the points what happens actually. So, first one is transient vasoconstriction. Transient means for the short term, for a very shorter period. Vasoconstriction means blood vessels will constrict, narrowed. With mild form of injury, blood flow re-establish within 3 to 5 seconds. So, when there is a very mild or minute injury, so the within 3 to 5 minutes the blood flow again re-establish. But in the case of severe injury, vasoconstriction may last for about 5 minutes. Okay. So, that time that is not for 3 to 5 seconds, it is up to 5 minutes. Persistent progressive vasodilation mainly involves arterioles, also has little effects on venules and capillaries. Persistent progressive vasodilation, the terms means persistent means continuous, progressive slowly it is increasing, vasodilation blood vessels dilated. So, dilation will increase persistently. So, first it was vasoconstriction, now the dilation will start. Mainly involves arterioles, also has little effect on venules and capillaries. So, mainly arterioles are in fact affected, but it has also effects on venules and capillaries. Third one, elevation of local hydrostatic pressure. Elevation of local hydrostatic pressure, increased in blood volume, in turn elevate local hydrostatic pressure, cause transudation of fluid into extracellular space. Means the fluid will transudate from inside the blood vessels outside the extracellular space. Fourth one is slowing and stasis, the speed. It causes increased concentration of red cells and thus increase the blood viscosity. When the plasma has been gone out of the blood vessels to the extracellular space, so the density of the blood has increased, the RBC will increase, the concentration of RBC will increase. So, the viscosity of the blood will also increase, and when there is the increased viscosity, it will slow the speed of blood flow and there will be stasis, low speed. Fifth one, stasis or slowing, it is followed by leukocytic margination. So, when there is a less speed of flow, the cells which are flowing through the bloodstream will be marginated, or peripheral orientation of leukocytes, mainly neutrophils. So, suppose this is flowing in center all the cells. So, in this margination it will flow like this way. Okay. So, this is the margination, this is the margination. Here the cells will be marginated. Which are the cells? Different leukocytes, mainly the neutrophils. Okay. So, the things can be seen. So, the mainly neutrophils, they stick to the vascular endothelium briefly. Endothelium is there in the blood vessels membrane. So, endothelium is present and that will be sticky for very limited period of time, the neutrophils and the other WBCs. Then what happens? And then move and migrate through the gaps in between the endothelium cells and extravascular space. So, there are gaps in between the endothelial cells, endothelium cells, and the WBCs will come out through the gaps into the extracellular space, that is called migrate. Next come to the altered vascular permeability. Inflammatory edema due to increased vascular permeability explained on the basis of Stirling's hypothesis. According to this, normally the fluid balance is maintained by two opposing sets of forces. What are these two forces? Forces cause outward movement and forces cause inward movement. These are the two forces, one is outward and one is inward. Next come to the cellular events. Cellular events, cellular stage. The cellular stage of acute inflammation is marked by changes in the endothelial cells lining the vasculature and movement of phagocytic leukocytes into the area of injury or infection. Now, come to the diagram, that is rolling, neutrophil, L-selectin is there, shedding of L-selectin, integrin will help to fix with the L-selectin, then adhesion, then this is diapedesis. You can see in the blood vessel wall, these are the different complement system, C3a, C5a, chemokines, then histamine, prostaglandins and leukotrienes, all we studied in the last PPT, different mediators of inflammation, that all will work there. Then see the lipopolysaccharides, interleukin 1 and tumor necrosis factor alpha, that will act, and ultimately what will happen? Phagocytosis and destruction of C3b coated bacteria. Phagocytosis and destruction of C3b coated bacteria, and that is activating substances released by bacteria and damaged tissues. So, this is the cellular event you can see in this diagram. So, cellular changes, there are cellular stages, these are the 7 stages that I will discuss you: margination and rolling, adhesion, transmigration across the endothelium, that is called diapedesis, chemotaxis, this is migration, formation of inflammatory barrier, opsonization, phagocytosis and killing. So, here see the stages like of these events. So, see here it is rolling, capturing, tight adhesion, diapedesis, chemotaxis. So, if you see in the last slide, these are the stages I told you: margination, rolling, adhesion, transmigration across the endothelium, diapedesis, chemotaxis is migration, formation of inflammatory barrier, opsonization, phagocytosis and killing. So, these all things are covered here. So, these are the proteins L-selectin, E-selectin and P-selectin, which attach with the glycoproteins, and here you see this is endothelium. This chemoattractants on the endothelial cell surface. So, what will happen? Leukocytes will capture here, it will roll on the endothelium. In the slowing and stasis phase, it will the rolling will be slower. This is form adhesion on the with the endothelium. Then transmigration through the gaps in the endothelium. This is the gap, and these are the things which will help in this process: selectins and integrins. Then other chemoattractants in the tissues. So, these all things will help to come out from the through the endothelium gaps. Next come to the exudation of leukocytes. Main stages of leukocyte margination are as follows: margination and rolling. So, in this stage vasodilation stasis occurs, RBC forms coils in the middle of blood vessels. Peripherally marginated and pigmented granulocytes, this is neutrophils, are slowly roll over the vessel wall. Second one is adhesion. Adhesion is granulocyte adhere to the endothelium. Granulocyte adhere to the endothelium. Adhere means stick. The granulocyte stick to the endothelium. Function of adhesive protein, that is integrins and pigmenting. So, that is adhesion and pigmenting. Pigmenting means that will be marginated on the side of the vessel wall. Third one is immigration, which is diapedesis. Extravasation through pores of the vessel wall is called immigration, which is also known as diapedesis. Extravasation through pores of the vessel walls means through the gaps of the vessel walls. Chemotaxis, this is migration. Chemotaxis is migration. Migration to the target organ and function of chemotactic substances like neutrokines, leukotrienes, interleukins, complement system, leukotriene B4, L4, L8, C5a, C3a. These are different complement systems, leukotrienes and interleukins, which are act as a chemotaxins for the migration process. Now, come to the formation of inflammatory barrier. So, inflammatory barrier is forms, and in the sixth it is come as opsonization. The coating of an antigen with antibody or complement to enhance binding. A coating of an antigen with antibody or complement. The complement system I have told you, there are like C3a, C5b, these are all the complement system, complement factors. So, they to ensure binding. So, they ensure the binding. Main opsonins present are, which are the main opsonins? IgG opsonin, naturally occurring antibody IgG in immunoglobulin G, C3b opsonin, lectins. So, these are all the opsonins which help in the opsonization to enhance the binding. Seventh one is phagocytosis and killing. So, engulfment of solid particulate material by the cell. See, phagocytosis and killing, this is a common process which you have also studied in first semester in the anatomy physiology, like in the phagocytosis. So, what is phagocytosis actually? Phagocytosis like engulfing. So, like there is a cell and that is a antigen. So, what will happen? So, the antigen which was there in outside will gradually engulf by the cell and it will go inside the cell and then it will disintegrate. The cell will, because of the presence of different enzymes, will degrade the antigen and means it will kill the antigens, whatever the antigens means, that may be some bacteria, then virus, may be some other damaged cells or some pollens, whatever. So, engulfment of solid particulate material by the cells. Two type of cells, polymorphonuclear cells, these are macrophages, and second type of cells are the macrophages, monocytes and neutrophils. These are the macrophages. Macro means bigger, micro means smaller. It involves three steps: recognition and attachment, engulfment and killing and degradation. So, this is the recognition, the cell will recognize the someone is some agent antigen is there, then the second, that is engulf, it has been engulfed here, and then it will be degraded, it will kill and degrade the substance. Thank you.